The DDS form can be found within the Diabetes Visit FP form located in the HCN Forms directory. Once you're there, you will see a tab labeled DDS Score. Within the form, there are three important components: the embedded online form at the bottom of the page, the interpretation legend at the top left corner, and the resource links at the top right corner. The embedded links functionality is similar to that found in the ASCBD Risk tab, which most of you may be familiar with already. You and your staff will be able to navigate that link within the form without having to access any external links. When assessing the patient, you will select the type of diabetes the patient was diagnosed with, and you will be presented with a brief explanation of the purpose of the DDS score. Then you will be directed to the assessment itself. The assessment is composed of 28 different items. For the purpose of this demonstration, I will select random scores for each of the questions. Next, you will be directed to the score Rationale, which notes that the patient should be considered to have significant diabetes distress if the overall score is 2 or above. The 28 items assessed are also categorized into 7 distinct areas of distress. The first one is feelings of powerlessness. The second is management distress. The third is hypoglycemia distress. The fourth is negative social perception distress. The fifth is eating disorders. The sixth is physician distress. And the seventh is friends and family distress. The last page will display the overall DDS score as well as the scores for each individual category. The individual category scores can help you guide the follow-up treatment plan that you might be considering for your patient. Once you and your staff have completed the assessment and obtained an overall score, you will be able to record it in the upper left-hand side of this form. In this case, the score came back as 3.64. So we will select 3.0 or higher, which indicates there is high distress. If the patient can benefit from obtaining more information about or research to manage their diabetes distress, the hyperlinks in the upper right-hand side will allow you or your staff to print out useful information for the patients. Finally, if we navigate to the preview of this note, you will see how this assessment will be documented in your note. The assessment will show under Tests, and the DDS score, as well as the interpretation for its given range, will appear as a description in your note. This again can help you identify if the patient's diabetes distress is improving or not. Depending on the operations at your health center, it might actually be useful to print out the survey and give it to the patient so that they can answer while they're waiting for their appointment. If that is the case, you can still use the embedded form within this tab. Click on For Providers, and then click on Access the Diabetes Distress Survey, which will lead you to this page. In here, you can print out the DDS survey in Spanish or English so that they can take it while they wait for their appointment. The negative side of using the printed version of the survey is that your staff will have to do some calculations for the form in order to get the overall score. So we strongly suggest that you use the embedded link to navigate through the form and make the process a little more easy.